The Western Cape Department of Health and Wellness says the unveiling today of a multi-million rand LINAC machine at the Tygerberg Hospital's Radiation Oncology Department is part of their commitment to bring quality and state-of-the-art technology and high care to those who are vulnerable and may not be able to afford it otherwise. Of course, the machine has been in use since August, and about 80 patients have already been treated. To speak to me about what exactly this machine does, I've got with me Dr. Henriette Burger. She is the head of the Division Radiation Oncology at Tygerberg Hospital and Stellenbosch University. So this is a very interesting looking and intimidating machine, but you say that it's already assisted almost 100 patients since August. Explain to us what this LINAC machine is and how it helps in cancer treatment.
So the linear accelerator, and specifically this Varian TrueBeam linear accelerator, will enable us to offer specialized radiotherapy techniques to our patients. We could still offer all the standard curative and adjuvant radiotherapy, but we will also now be able to do pinpoint radiotherapy of small tumors located in the brain, in the liver or the lungs. And we will also have new technology helping us to position our patients perfectly and track patient positioning, which will all increase the accuracy of the radiation treatment.
And that seems to be, Doctor, if I understand it, one of the big features here is because generally, tumors come, as you said earlier on, in different sizes. So explain to us what you would do when a patient is on the bed, how you would mark out the area that needs radiation treatment, and then how this machine assists in sort of minimizing the risk to the surrounding tissue and organs.
So when we do long courses of radiation treatment, let's say a course of 6 weeks, we actually start with a CT scan of the patient's tumor and obviously the body part involved. So we are able to look on a three-dimensional level and map out where the tumor is that we want to target, but also where the normal organs are that we would like to avoid. And so this machine in addition to looking on the surface of the patient in terms of the skin and the small tattoos that we use, the machine actually has a built-in X-ray machine and a CT scan machine, which on a daily basis can take images of the patient to make sure that the tumor and the normal organs are in the correct position.
Earlier on, we spoke to one of the patients, Mr. Haywood, who actually he was treated here, and he was talking about the benefits to patients like himself. What are some of those benefits? Does it mean quicker recovery, no need for hospitalization, or what does it mean to be treated? Perhaps, if I could ask your colleague Didier to explain to us the benefits of the patient by using this kind of high-tech equipment in the treatment of cancer.
Sure. So the benefits of this machine and everything that comes with it is mostly the patient positioning and monitoring systems that we've got. Of course, not to mention the techniques that we can actually treat our patients with, but this bunker is equipped with 3 cameras that constantly monitor the patient's surface. It projects about 1,000 or so points on the patient's surface, and if the patient were to slightly move out of position, it will stop the beam, and it will only restart once the patient has moved back into the correct position.
So it essentially means that the patient will not have to be hospitalized for long periods of times, and that once the course of treatment is complete, they start feeling better much quicker.
So each patient is different in terms of how they react to radiotherapy, but what it does do is does ensure that we are treating a lot more accurately, and patient's positioning is a lot more reproducible, which hopefully results in good patient outcomes.
Thank you so much for speaking to us, of course, there from the Radiation Oncology Department at Tygerberg Hospital and Stellenbosch University, just giving us an update on a quite remarkable piece of machinery and equipment being used here at Tygerberg Hospital and the Department of Health and Wellness in the Western Cape, saying it will go a long way to assist and to treat the health and cancer treatment outcomes of more than 3,000 new cancer patients at Tygerberg Hospital each year.